Good morning and welcome to the Monday morning briefing regarding COVID-19. Today we have with us Bryn Kerrigan from the Department of Public Health and Ryan Alsop, our Chief Administrative Officer. So first I'm going to hand it to Bryn for an update from Public Health.
Good morning. Unfortunately, we're announcing that there's been 2 additional deaths related to COVID-19 in Kern County, and 74 new Kern County residents have been diagnosed with COVID and reported out today. An update for our skilled nursing facilities. As reported by the state, as of June 6, 2020, Kingston has a cumulative healthcare worker positive count of 54. With 83 cumulative residents testing positive for COVID-19, and Kingston is reporting that 23 are currently positive and remain isolated within the facility. And they have a total of 19 deaths related to COVID-19. Valley Convalescent has 21 cumulative healthcare workers that have tested positive for COVID-19, 43 cumulative residents that have tested positive for COVID-19, and has experienced 6 deaths related to COVID-19 within their facility. Ridgecrest Regional Hospital and Liberty Ambulance continue to provide daily strike team staffing assistance to this facility. Golden Living Center Shafter has a total of 10 cumulative healthcare workers that have tested positive for COVID-19, with no known cumulative residents at this point that have tested positive. The Orchards Post-Acute Bakersfield has a total of 10 cumulative healthcare workers that have tested positive for COVID-19, a total of 6 cumulative residents that have tested positive for COVID-19, and they have experienced 1 death within their facility related to COVID-19. Our skilled nursing facility testing program remains active. Our staff has tested 759 skilled nursing facility employees to date. We are today in Parkview, Julianne, conducting testing, and tomorrow and Wednesday we will be in Rosewood conducting testing. Our remdesivir antiviral that helps with shortening the duration of COVID-19 symptoms. Kern County has received 474 doses to date, and we anticipate a shipment of 178 doses this week. We also anticipate 2 additional shipments of unknown quantities throughout the end of this month. With that said, I'm going to hand it over to Megan for an update on testing.
So we currently have 9 state or county funded sites that are still operational. The state sites are the Kern County Fairgrounds, Mojave Veterans Hall, and the Arvin Public Health Building. The county-funded sites are in Oildale at the Good Samaritan Hospital, the West Side Healthcare District in Taft, Adventist Delano Regional Medical Center in Delano, Kern Valley Hospital in Kern River Valley, the Ridgecrest Regional Hospital, and Adventist Health Tehachapi Valley. We are also looking for locations in the Wasco area, the Lamont area, and are still looking to relocate the drive-through center that was at the Richard Prado Center. We have conducted over 6,000 tests at those locations and continue to evaluate the needs of our community. With that, I'm going to turn it over to Ryan Alsop, our Chief Administrative Officer.
Morning, everybody. Today in Kern County, population 900,000 plus. 33,369 residents have been tested for COVID-19. Nearly 30,000 of those residents, or 90% of those tests, are negative. We're continuing to seek the results of about 816 residents, or 2% of those tested. 2,794 residents, or 8% of those who have been tested, have tested positive. Of the 2,794 residents who've tested positive for COVID-19 in our community, 2,690 or 96% are either fully recovered or are recovering at home, treating their symptoms at home on their own. Today, 59 residents in Kern County, or 2% of those who have tested positive, are receiving care of some sort in an area hospital. Unfortunately, 47 residents, or 2% of those who've tested positive, have passed away. Over half of the deaths are attributed to at least 3 different state-regulated skilled nursing facilities in our community. As of today, 26 or 55% of Kern County's total 47 deaths are related to COVID-19, have been residents, patients at 3 different state-regulated skilled nursing facilities. As Ms. Kerrigan mentioned earlier, about 255 of the positive cases that we have in our county are either healthcare workers or residents at 6 different state-regulated area SNFs, skilled nursing facilities. These SNFs continue to be a concern for our local public health team. And my office, we're continuing to monitor. We're continuing to work with the state on a daily basis in containing, testing, and monitoring the situation at these skilled nursing facilities. Late last Friday, in the afternoon, the governor issued guidance for many Stage 3 businesses in our community to allow those businesses to begin reopening. Those businesses are as follows. These are campgrounds, RV parks, outdoor recreation, things like pools, other outdoor recreation, card rooms, satellite wagering facilities, racetracks, casinos operated by sovereign tribal nations, day camps, family entertainment centers, film, television, and music production, fitness facilities, hotels, museums, galleries, zoos, aquariums, pro sports without an audience, restaurants, bars, wineries, schools. Those industries the state has issued guidance for. That guidance can be found directly on the county's website. That's kerncounty.com. It's front and center. You can't miss it. For those of you wondering, well, what businesses are not open, those are nail salons. The state has not allowed nail salons to reopen. They have not issued guidance for nail salons to reopen. Tattoo shops. I get calls from tattoo shops in Kern County. You may not open under the state's current directives. They have not issued guidelines for you. Youth sports. These are organized activities, organized sports. Even though pro sports are allowed and there is guidance for pro sports without an audience, there is no guidance, no directive on youth sports, organized youth sports here in Kern County. Movie theaters cannot open yet. Nightclubs, even though bars are open, you can go sit at a bar, you can patronize a restaurant and sit at a bar at a restaurant. If you're going to go out for a night of dancing at a nightclub establishment, that is currently not allowed by the state. They have not issued guidance. Things like laser tag, karaoke, these are some of the questions we get. Those are not allowed under state public health orders. We continue to await guidance on all of those types of businesses and those activities. It's really important that people understand that if they can get information related to the state's guidance at kerncounty.com. We've got it there front and center. We also need to remind everybody that we must continue to operate under best practices as a community, and making sure that we're adhering to the guidance of public health officials for any of these industries that have begun reopening, to continue to practice social distancing, to continue to wash your hands, don't touch your face, wear a face mask. It's recommended if you cannot social distance, certainly if you're in a crowd of people traversing through areas that have crowds of people. If you're not able to social distance, it's recommended that you wear a mask. Again, wipe down surfaces, don't touch your face, wash your hands, folks, and be smart as we go forward. In addition to the county working very hard to get our businesses reopened and operating under certain guidance, as you know, we have established a program called Kern Recovers. You can get information on this program on the county's website. We are offering streamlined permitting process for retail establishments and restaurants and others who want to expand the scope and size of their space for their patrons. That information, again, is on our website. We have begun offering financial assistance to qualified Kern County small businesses. This program was adopted a couple of weeks ago by the Board of Supervisors. We've been operating for about 2 weeks now. My last check this morning, we have provided about roughly over $1 million to Kern County small businesses that have applied. So to date, about a little over $1 million to those businesses in financial assistance. It's about 55 or 56 total loans over the last couple of weeks, and the average of each one of these loans is around $22,000 per loan for those that are interested. In addition, we will be discussing with our board next week at our Board of Supervisors meeting an additional practice under the Kern Recovers program. This is PPE support for area local small businesses. PPE, personal protective equipment. The county will have a goal of supporting 5,000 area local businesses, individual businesses. We will be bulk purchasing, the county using the county's purchasing power, bulk purchasing PPE equipment and other sanitary supply equipment and distributing that equipment. Again, a goal of 5,000 individual small businesses within Kern County, distributing that equipment among those businesses. We will be, again, discussing this with the board. This is part of the Kern Recovers program. There'll be more information on that program here toward the end of the week once the county's agenda is put out, and I will be talking more about this as we go forward. We think this is going to be incredibly helpful for our local small business community to assist them in a very trying time, in addition to the financial assistance that we're doing and the other permit streamlining functions that we are practicing as a county. Again, all this information on the county's website, kerncounty.com. Lastly, next week we'll also be discussing with the board the food insecurity needs for our vulnerable seniors in this community, those 65 and up, many of whom have pre-existing health conditions. It's a food program. This program is funded through the Federal CARES Act. The Board of Supervisors set aside $2 million of that CARES Act money several weeks ago at their board meeting. We are going to be recommending entering into an agreement with Community Action Partnership of Kern, CAPK, for this program that would deliver meals throughout Kern County to those 65 and older. We'll also, part of this program, will be adding 2 additional distribution sites for the Commodity Supplemental Food Program. It's also known as the Senior Food Program. These sites will be opened in areas that currently aren't served by this program. And there are other individuals in the community that may be younger than 65, but also have severe health conditions, pre-existing conditions that may qualify for this program. Again, the program is $2 million through CAPK, food insecurity assistance, getting meals delivered out to our vulnerable seniors throughout Kern County. That program will go from today through the end of the year, and we'll be reevaluating where we are come December with this program. So with that, I'm happy to answer any questions.
Okay, two things really quickly before we start going through the media outlets to answer questions. If you are a business industry that has questions about the guidance, the Public Health Call Center is available to you to help you walk through that guidance. Their phone number is 661-321-3000. And on the Kern Recovers program on the website, you will find information. We do ask that you only apply to one bank. We're finding that businesses are applying to all four. That's not necessary. You just have to pick one, and it actually speeds up the process. So make sure that you don't apply to all four, and they are still accepting those applications. So remember to stay muted until we call you. *6 to unmute, and we'll start in the order that you've received. Our first outlet is channel 23. Is there anyone on the line with questions?
Yeah, hi, good morning. Can you hear me? Hi.
Yes, go ahead.
Hey, good morning, guys. So I know in previous weeks, Matt Constantine said that typically the new cases per day is around 30, but it seems in recent days that number has increased. My question is, what does the county make of that? Is this possibly a result of some business functions being expanded and the protests that have been going on in large groups for the last 8 days? And also, could this rate of growth, if it continues, have any repercussions in our abilities to accelerate through the phases?
Okay, I think we're going to have Bryn Kerrigan respond to your question. Give us just 1 second.
Good morning. Our average new cases is about 50 now. And we think that this is a good opportunity to remind our community of the obligation we all have to implement these protective measures to slow down the rate of transmission of COVID-19. We do think there are multiple factors that play into seeing this increased number of cases. One of the most contributing factors to this is the additional testing that we've implemented, now allowing those that are asymptomatic to be tested and to test positive. That is a helpful tool for us because then we are able to have those individuals who have no symptoms that do test positive, identify that early, and have them be under self-isolation so that they're not transmitting COVID-19 to anybody else within our community. We are happy to see our businesses start to reopen under the guidance that has been provided by the state. When they comply with that guidance, there is a relatively low risk of transmission of COVID-19 because they are implementing many protective measures to ensure that physical distancing is occurring within those facilities.
Okay, thank you. So in other words, there would be no repercussions in our ability to accelerate through the phases, even with the additional growth rate.
Thank you. I apologize for not addressing that part of your question. There could be repercussions for Kern County should our community not take this seriously and not implement these preventative measures. The state has implemented a monitoring program where they are monitoring where our case rate is, where our testing positivity rate is, and how our hospitals can accommodate those that are positive that require hospitalization. And should we exceed these monitoring criteria, we would have to consult with the state to determine what actions we have to take. There could be repercussions, and that's why I would continue to urge our community to take this seriously and implement those protective measures.
Thank you so much.
Our next outlet is Kern Soul. Do we have anyone on the line with questions?
Hi, good morning. This is Elizabeth from Kern Soul News. My question today is I'm not sure if you guys know this, but when can we expect guidelines for businesses like nail salons and the other businesses that are in stage 3 but aren't allowed to reopen yet?
I don't believe anybody has a read on when that will happen. There's no crystal ball. I think we're all eagerly awaiting that information. As soon as we do find out, we will post it between the two websites and make sure that it's available to everybody.
Okay, thank you.
Mm-hmm. Mojave Desert News, anyone on the line with questions? Channel 29.
Hi, this is Tyra Majors with Channel 29. My question is about the remdesivir shortage. The U.S. government supply is supposed to run out at the end of the month. What does that mean in Kern County, and do we know that it has worked here for any residents who've had COVID-19?
So we'll have Bryn respond to your question. Give us just 1 second.
Thank you.
Good morning. It has been given to patients in Kern County, but whether it has impacted their outcomes, it is uncertain. It is relatively new, and so we're still trying to determine the actual clinical impact that it does play on our patients. I mentioned earlier we are anticipating an additional shipment this week of 178 doses, and then 2 more additional shipments before the end of June. And we look forward to being able to use it on our Kern County residents.
Thank you. I have a quick follow-up question. It's regarding schools that are able to open up under the guidelines as well. Are you guys working with Kern County Superintendent of Schools as far as summer schools reopening, and what can families expect to hear about that?
Yeah, so we do have conversations with the Kern County Superintendent of Schools. I would encourage you to reach out to the districts themselves because they're each working through that, as well as waiting information from the California Department of Education within the next day or so.
Thank you.
Channel 17, anyone on the line?
This is Karen Hua with Channel 17. My question is, with the recent protests, are you concerned about more COVID cases as a result of that, and especially further affecting Black and Hispanic people disproportionately? We see that they're already majority affecting Hispanic people in Kern County.
Hang on, Karen, we'll have Bryn respond to your question.
Thank you.
Hi, Karen. Anytime there is a gathering, a large gathering of many people from different households, that does bring about some concern for an increase in COVID-19 cases. We are uncertain if that will impact any of our, any of the Hispanic population or the Black population greater than any of the other populations. And we're just going to have to wait and see the true impact that those protests have had on our COVID rates.
Okay, thank you. And a quick follow-up. Will there be any guidance on things like private gatherings, like hosting a small house party or a barbecue or something in your own backyard?
Hi, Karen. We've had many conversations with California Department of Public Health on gatherings. Their gathering guidance remains where they are recommending that there be no gatherings outside of those that reside within the same household. We would anticipate that as they change that gathering guidance, that they would provide some corresponding guidance for how individuals should interact when they are with people that are outside their household.
Thank you very much.
Next, we have KNZR. Anyone on the line with questions? KUZZ? The Bakersfield Californian? I'm gonna pause.
Can you hear me?
Yes, I can. Go ahead.
Hey, this is Sam. My one question is, do we have any idea of how many tests are taking place per day since the county opened these 9 testing sites?
I can get you the totals on those, Sam. I can tell you that since we opened, we've done 6,066 tests. Exactly, I think there's one site that is missing 2 days worth of data, but that's since we first opened on, I think the first location opened on May 4th.
And then just looking to compare that to how many tests were taking place per day before those sites were open, just so we can get some sort of comparison there.
Yeah, I'm not sure. I wouldn't have access to the previous test data or what's happening outside those sites. I think we can get a number back to you, though.
Okay, all right, thank you.
Oh, I think Ryan wants to respond to that.
Oh,
Hey, Sam, just ask a favor of the Californian. If you guys could print right on the front page of your paper all of the different sites and where people can go, the times, the directions, that would be incredibly helpful for getting the word out and ramping up the number of tests that are conducted at these places. And we would appreciate that.
I'll pass that on.
Okay, anyone from Kern Radio?
Good morning, it's Ralph Bailey.
Good morning.
I have two questions. One, I wanted to go back and go over Dr. Dan Erickson's theory. Everybody in the medical profession, the AMA, local doctors, call this guy wackadoo. 3 months into it, the stats have stayed pretty steady to his theory. A lot of cases, low deaths outside of 65 plus, and folks with pre-existing conditions. Ryan just reported 8% positive, 96% recovery. Does the county still color this guy crazy, his theory of herd immunity in Sweden, which never closed, and whose numbers relatively are right on par with ours? You guys still think this guy's nuts?
Hang on one second, Ralph, and we'll have public health respond first.
Hi, Ralph. Coronavirus 2019 remains a novel disease. We continue to do as much research as we possibly can based on the data that we have incoming, and we hope to have more insight on different measures that could potentially be taken if they should change from what we are currently recommending for our community as we have more information on the disease.
Okay, but my question was, do you all still believe that Dr. Erickson's theory of herd immunity is not sound?
I think both Ryan and Bryn are going to respond.
Hi, Ralph. We actually never took a stance on the statements made by Dr. Erickson. That was actually made by two medical societies, nationwide medical societies, who
Do you have an opinion? Do you have an opinion now?
Who released a letter indicating that there was not sufficient evidence to support the claims that were being made. As the public health department, we feel that this is a novel disease, and we are going to continue to do some surveillance and research on the information that we have coming in to make decisions based on that information.
So, but is there you don't have any statement on his theory now? Oh?
Hey, Ralph.
Hey, Ryan. Mr. Alsop.
I would, so to Bryn's point, I think, the county never took a stance, to my knowledge, on those comments. I can only tell you just from my personal comments, my personal thoughts on the matter are that I think Dr. Erickson is courageous, and I think that he made a lot of good points when he talked about the numbers and the data. I think he said a lot of important things in his long press briefing that he had. There are, many, many different opinions coming from many, many different places about his comments, but I think he's a courageous doctor. I think he, spoke his mind, and he told everybody what he believed. And so for that, I think he gets a lot of credit for being courageous and stepping up early on. And that's as honest and thoughtful as I can be on the matter.
Okay, and one other quick question, and I apologize if you addressed this, but you talked about youth sports. Does that include high school sports? Will we see high school football in September?
I hope so, Ralph, but it's unknown. We really don't know. I mean, I've got a kid who plays, who's in high school sports as well. I'd like to see these kids get back into their programs. I know that we're right on the verge, particularly with football. There are other sports, fall sports, where practices are, should be starting up for the fall. It's unknown, and we're going to be talking with the state and really leaning on the state for guidance in this area. We're going to be working with the school districts to figure out how they're going to manage it. But it's something that we are. It's not lost on us. It's something that's very important here, and we're going to continue to have conversations both locally and between Kern County and state public health officials on any forthcoming guidance in that area.
Thank you, sir.
Okay, that concludes our list of media that we believe is on the line. I'll ask one more time for any final questions. Okay, that concludes our Monday morning briefing related to COVID-19. We'll be back on Thursday. Thank you.